again, I had mentioned I'm in a mom community, and one mom was panicking, you know, saying, my child is 16 months, has not yet walked. Oh my God, what's happening? Are they okay? You know, and we keep having all these concerns with moms, like speech development. You know, they're not speaking at the right time. We're comparing sibling 1 and sibling 2. You know, generally development milestones. You know, what are things that we need to maybe look at or talk about regarding the kids?
I think, first of all, I think the people who tend to panic most, you're right, are usually the first and second. Actually, first time, then second time, because you're
comparing.
Yeah. Einstein, I think, walked at 2 years.
At 2, eh?
Hey. All right, and probably spoke much later. So for me, it's not a race. And actually, the earlier you walk has nothing to do with how intelligent. I love seeing mothers show off. My child walked at 3 months. Okay. You know.
Excuse me. Yeah.
As if it's an achievement.
What about spoke at 8 months?
Yeah, that's what I'm saying. Those are not achievements at all. So we all go through milestones, all right? Yeah. And you find that there is no attachment. The only thing you need to understand is what we call red flags.
Yeah.
All right. So red flags are important because they can give a sign to some of the what we call neurodevelopment conditions. So things like autism, ADHD, and stuff like that. But those ones you can easily tell pretty early. So so the issue here is that your child should walk in their own space. The other time someone came home, my child is 18 months. They said, your child can't walk. They went and bought us a stroller. And I went and threw it in the dustbin.
The stroller, the walking thing, the one where it's walker.
Yeah, is it the walker?
Walker.
Yeah, what's the walker? And I went and threw it in the dustbin. I'm like, now you want to delay the walk because those strollers delay. They are very bad. In fact, you shouldn't be using them. All right.
Walkers.
I wish we could. I wish we know.
Walker is the one where you put your child in so that it helps them.
That's even worse.
Yes.
Yeah, that's worse. That's terrible. So you shouldn't be doing that. You shouldn't be getting that. Yeah. So the first thing is that when your child develops, they first develop what we call the gross motor skills. Okay. So the motor are the muscles, things for touching. So the first thing they do is the gross motor is. Are they able to move their trunk? Because they're, all right?
Yeah.
So okay, maybe before that, children are born with what we call, what's the term? They are born with certain skills, all right? So for example, if you touched your child's palm, you expect them to grab it, all right? If you did this to your child, they're supposed to turn around, right? If you put something in your child's mouth, they're supposed to circle it, right? So those are core. We call them primitive reflexes. So that's number one. Now, actually, what is more important is those primitive reflexes should go.
They should go.
They should disappear as the child grows. In fact, if a child's primitive reflexes don't disappear, even if the child is growing well, I get worried. All right, so they what we call a moral reflex. A moral reflex is if you take your child and you put them here and you dropped, the head is here and then you dropped that, the child should do like this. So that's a very good predictor of issues in a child. If the child can't do that at birth, there's a serious issue. The child can't do that at 3 months, there's an issue. If it persists at 6 months, there is an issue. So what's more important, rather than the development, is presence of primitive reflex, and then persistence. So after 3 months, they should go. That's when now your child has a chance to start turning, to start sitting. They can even start smiling at 3 months. So we call it a social smile. And then by 6 months they are sitting. But even if they don't sit by 8 months or 9 months, it's still okay. No panicking. You understand? Because remember, you're looking at certain different things. So most kids, they start standing up at 1 year. They start walking a bit. All right, by around 1 year, as I said, my child is 18 months. I can't walk yet, but I'm not panicking. Actually, she's sharper than all the other ones, you know. And so, but for girls, if they don't walk by 2 years, that's a red flag. For boys, if it's like by 18, 19 months, it's usually a red flag. Red flag just means take the child back to the doctor and let the doctor confirm there is nothing else, all right?
Don't confirm by yourself.
Yeah, so we call those red flags, all right? For example, if your child by 18 months, 18 to 2 years, between 1.5 to 2 years, doesn't have two or more, can't put 2 or more sentences, or doesn't have like 15 words together, right? But parents tend to know. But you find that, for example, for my child who was born in COVID, just before COVID, because everyone isolated, the speech delayed. But the moment schools opened, and when took him to school, it just flourished. So just because there's a delay doesn't mean that there's something wrong. All right? Usually the commonest cause of delay is you haven't been talking to them, haven't been encouraging them. All right? A core cause of delay is usually they can't hear or speaking, they can't hear. So if a child doesn't turn, all right, and they can't talk, then that's an issue. They will not develop. Some children, of course, can have autism, and that's one thing that in this town people love talking about and declaring. I think in many times I think it's overdiagnosed in many instances. And but one of the core features is usually delayed speech. But you can usually tell because it's not just delayed speech. When children are not interacting, okay. A core thing with autism, for example, is the child is always alone. They used to say that a child with severe autism can't tell the difference between you and the table. You understand? The level of empathy and human connection is the same for a child. And then they tend to have repeated behavior and they don't want to be disturbed. And on top of that, they'll have delayed talk. So you see, it's not just one thing. So my mother says, oh, my child can't talk. I read on the internet it's autism. I'm like, no. There will be so many other issues that you can actually look at. All right. So if a child really can't say much, say by the time they are 2, 3, they're not even because speech or communication can be expressive, it can be implicit. There's a lot of things with speech, and you can easily tell that this one either they're having difficulty in expressing or they're having a difficulty in understanding. So, for example, they want to know by 18 months you should know that this can be drunk. Right? If a child can't know that this should be drunk, those are subtle signs of autism. They just look at it as a rock or something like that. So they should be able to attach roles and functions to certain things. Yeah. So those are really the common things. But for many mothers who come, first of all, for me, the first red flag is a mother who is concerned about their child. That's the first red flag. That's for me. Then all other red flags are, by 2 years, you're not yet walking. Let's see. Is there an issue? And usually, if it's there, or they are not crawling, or if they are crawling, it's something different. Usually, there's something else that comes with that development.
So see your PED, please. I think it's the best thing.
That's why we said for me, as a PED, all I do is monitor and evaluate. I'm a monitor and evaluation officer. I'm an M&E officer. And that's all you need. And then you encourage the mother, go home, or you intervene. Okay.
First-time mom who's living in the hospital, and there's certain things, as a PED, you think she needs to be aware of or know as she's living. I know there are many, but things like, for example, like jaundice. Like, for example, my daughter, we left, the PED said everything is okay, we went. After a few days, the eyes were so yellow, and then now it became, oh my God, then they checked and that thing was really high, So some things that can just help a new mom or first-time mom just calm down, especially in the first month, as you live.
That's difficult. But no, the most important thing is, as I said, if your mom knows how to breastfeed, for me, I'm okay. That's number one, because everything else can be taught, can be added on. 2, understand signs of illness. Okay, for a child, for a newborn, first of all, for a newborn, if you touch at the top of the head, okay, that's what we call the anterior fontanelle. So the child has two gaps. There's the big gap here, and then there's a smaller gap at the back, what we call the posterior fontanelle. So this is the anterior fontanelle and posterior fontanelle. So the first thing I tell mothers is please touch, and usually when they touch, it's soft, right? And that's soft. The moment it's soft, you're good to go. If you ever see it bulge, run back. If you ever see it's hard, come back, because that could be a meningitis. So that's a very simple thing I tell all mothers. So that's 2. So first is, as long as the child can breastfeed. 2, just look for a subtle sign, for a subtle danger sign. 3, if a child who's been breastfeeding stops feeding, okay, stops feeding, because sometimes the child can have infections and there will be no temperature because their temperature system hasn't yet well developed. So the subtle signs is the child is crying all the time and the child has stopped breastfeeding. Those are the 2 things. Come back. We just call them danger signs, and we'll check a few things. Yeah, those are the key things. The thing with the the yellow color is usually due to bilirubin. What we call bilirubin. Bilirubin is when your red blood cells are old. The things that touch, so your red blood cells have iron. You see that iron again?
It's coming back.
Yeah, so it's called heme. So heme is basically iron with a few molecules that capture oxygen. So in the middle of there is iron and heme. And when it's broken down something called bilirubin. And that bilirubin ideally is taken out of the body through your liver, your bile. It's something called a bile. And it goes into your stool. So the thing that makes your stool brown is bilirubin. So if you have issues with bilirubin, excreting bilirubin, your stool color will be cream. That is why early on you will see many children. No, that's not true, because young children a few-day-old kids tend to have meconium. And then after that, they can have also a bit of creamish, and then once the bilirubin system comes in, then their thing becomes brown. So stool is basically brown because of bilirubin. Now, if bilirubin can't get out, if there's a blockage, can't get out into the intestines to join the stool to make it brown, then you see a cream stool. Your child's bilirubin will go elsewhere. And that's why you see it in the skin, in the eyes, because it can't escape. All right, so that's what causes yellow eyes, yellow skin, yellow this, yellow that, yellow this. So, number 1, a child should not be born yellow. Okay, that's rule of thumb number 1. So any child born yellow, they need to be investigated. There are issues. Either they have an infection which has caused a lot of red blood cells to die, okay, or they have a structural issue where the bilirubin can't leave. So any child, if your child is ever born yellow, there's an issue. Now, most times, your child is born okay because the bilirubin is being removed through the placenta. Through the what? Through the placenta. So once the placenta is gone, your bilirubin excretory system is not yet well developed in the first few weeks, first few days. So what will your child do on day 3? The bilirubin levels go up. That is normal. We call that physiological jaundice. No one should disturb you. The only thing that should disturb you is that if your bilirubin levels go so high, they can end up being deposited in the brain. And that can cause what we call connecterus. That's an issue. Your child can start convulsing and can eventually die. So that is why, if it's not physiological jaundice, okay, you want to do thorough investigations. The child remains and what not. But if it's physiological jaundice and it's really high, which is rare, really high, then we do different things to reduce. We do different things to reduce. All right. So the common thing is take your child to the sun at a certain angle. So bilirubin comes in different forms. If you remember your chemistry, okay. No, certain molecules can be the same molecule, but in different shapes. All right. So one of them is dangerous. The other one is not. So when you're putting your child in the sun and you want the radiation to, what you're trying to do is change the bilirubin to a certain harmless shape. That's what you're doing. And it's the same thing when you put it in the radiator, not the radiator.
Phototherapy. Yeah,
you do phototherapy machine. That's all you're doing. You're just changing it from an R to an L. That's in chemistry, if you recall. So if that one also fails, then we can do exchange transfusion. We actually remove
the blood.
Yeah, because it's food with bilirubin. So there are many ways you can reduce it.
Okay.
All right. So if the key issue is your child shouldn't be yellow at birth,
Yeah.
and if your child shouldn't be yellow after 2 weeks, because the physiological jaundice is between like day 3, and by the time it is 15 days, it is gone. So anything beyond that, there's an issue.
Okay.
Anything before that, there's an issue. So that's really the thing about child is yellow, child is not yellow, blah, 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 blah.
All right.
Yes, and then there's a thing that mothers, actually it's mostly nurses, they tend to, some nurses, they tend to really disturb mothers. So you find that many children tend to, they do a lot of snuffling. So they're not breathing well. And then the mother, and then the people say what? That the child, Yamira, is it?
I don't know that.
Or Kumira. They say the child has swallowed because the child is not breathing well. That's not really true. It's a common thing that many mothers come because as the child is still young, their respiratory system is not well developed, right? And there's a lot of resistance. So any small thing, you end up with mucus, and that mucus can disturb the child's breathing. So many mothers tend to come and say, "Oh, mwana wange bangambe yamira," but actually that's not true. What I'm told is they drowned in the meconium, in the fluid inside the womb, and that is why the child is breathing badly. That's not true. The child doesn't breathe inside there, right? So what happens is that it's just that you want to manage the mucus. Within a few weeks, the child will be well. That's really the key issues. Those are the common key issues in the new birth. And then, of course, vaccination. Many mothers these days are fighting vaccines, and I don't know why.
First-time mums usually get all vaccines. But the second, third child, you find that, that one.
No, but although what's more worrying is those people who have what we call vaccine hesitation. So now you find that when you go online, a lot of people say, you know what, these vaccines are what? These vaccines are not useful. They are out to kill us. Remember, even people are saying even the COVID vaccines are bad. Which is really not true. All right. So I think there needs to be a whole conversation around that. I'll give you an example. So when I was just starting out, in medical school, the death rate of children was 300 to 100,000 children, or like what we call live births. So 300. Right now we are down to like 30. And I can tell you for a fact, a core reason is vaccination. When I was in third year, the first time we went to the ward, we had wards filled with measles children, we had wards filled with so many infections, the meningitis, and these were because of the bacterial infections we talked about. Then Bill Gates introduced a whole raft, or paid for a whole raft of vaccines. When I was in fourth year, they were introduced in Uganda. We vaccinated. When I came back to the fifth year, when I was a fifth year, wards were empty. We had to close down wards. And the reason is the vaccines were working, the impact of the vaccines. You no longer saw measles cases unless the child was malnourished and had other issues. Because we vaccinated with measles, we vaccinated with a lot of these other, what we call hip vaccines. All these were introduced, and you could see a very, very clear distinction. And we had no children in the wards. So vaccines really work. And people are going to say, for me, I was not vaccinated.
But I'm okay.
Those ones are always there. Yeah, there are people who also survived COVID, but COVID also killed.
Was there?
Yeah. So I think that's something I just wanted to say, that it's a thing that is creeping up, that, you know what, these people are out to kill you. Who is out to kill you? People are going to Mars. Do they even know that you exist? They are busy making their own Ozempic. Who has time to kill you? What did you do to them?
To reduce our population.
So that what?
I don't know. Anyway, but then there are these, like the government drugs which are free, and then you find now the card has many more other things that are like 300,000 made in cocoa and whatnot. Are they important?
So you see, there are, okay, when we started there were 33 immunizable diseases. I think now there are like 63 immunizable diseases. So the thing is this. For those who grew up in the 80s, I think there were six.
Killer diseases.
which are immunizable.
Yes.
So, first of all, vaccines are not cheap. Let's start from there. Number one, to answer your question. There's no vaccine which is free. Vaccines are not cheap. You have guys, just like we talked about drugs, there are guys whose job it is to make vaccines. It's not cheap. Two, because it's not cheap, someone has to pay for them.
Yeah.
And the people who pay for them, funnily enough, are not your government. Okay, there's a group called Gavi, Global Alliance for Vaccine Initiative. Basically, what happened was in the late 90s, Bill Gates, once he became the richest man in the world, that's why I keep telling people, if Bill Gates dies,
We are finished.
go and bury.
Go
and bury him. Because,
Yeah,
and yet, a lot of people hate him.
Yeah.
All right, but if you're objective, so in the late 90s, Bill Gates said, look, I have this money, I want to help the world. What is the easiest way to help the world? And through a lot of reading, he realized that, first of all, the same way these companies are not making vaccines. Children in Africa, children in Asia, children in these places are dying of very simple diseases that children are not dying in the US. There is no manufacturer who's going to make a vaccine for a Ugandan, and they are there in Seattle.
Doesn't make
All right.
money,
So what he did, he went to the UN and begged people. They're like, So he and a group of his friends, rich friends, formed an alliance and said, look, I'll be contributing 100 million a year. In this 100 million, we're going to talk to the manufacturers of vaccines. We shall buy these vaccines. Instead of selling them to us at 200 per vial, sell them to us at 20 cents per vial. We will buy like billions and billions of doses. And that's exactly what they did. And that is what I said, that when I was still a student, that's what they did. They then introduced them. So what Gavi does, it buys vaccines, because you going to buy one is
Doesn't make sense.
expensive. So they buy these huge vaccines, then they bring them to the different governments, and they say, vaccinate Lisa's child. So those are the free vaccines you have.
Someone paid for it. Yeah.
Definitely. All right. So what government does, it provides the
free vaccine.
nurse. Actually, for me, I provide the nurse on behalf of the government. So the government provides the nurse, or the country provides the nurse. UNICEF provides the fridges, because most of this vaccine needs to be at between 2 to 8 degrees. All right. So Bill Gates provides the vaccines. So you come and say, Dr. Dan, I want my child vaccinated. I want the vaccines. So Bill Gates and Gavi sit down and say, what are the most serious vaccines that are killing the people the most? Number one, rotavirus. So 30% of children are dying because of rotavirus. So can we buy a vaccine for it? Yes, it's called rotavirus vaccine. Is it free? It became free in 2015 when Bill Gates started paying for it. Then we have pneumococcal, pneumonia and all these. All right, are there vaccines for it? Yes, it became free in 2018 when Bill Gates started paying for it. Hib and Hep, those are the ones I was talking about when I was a student. Those ones were introduced in 2003, 2002. All right, so Bill Gates is paying for them, he's mobilizing them, and blah, 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 blah. So you find that the ones that are killing your children the most
are the ones.
All right. Now, it doesn't mean that the ones that they haven't paid for
are not
important. All right. They are. So, for example, if you have sickle cell, there are certain types of pneumococcal vaccines that you're needed. So Bill Gates is paying for one batch. He's not paying for the ones of other batches. So you come, we'll tell you do that. What we call the meningococcal belt in Africa, which starts around Gulu up and goes all the way to the Sahel to lower Algeria, and there's a whole belt. If you're going to travel to West Africa, if you're going to travel to northern Nigeria, to northern Kenya, so there's a lot of meningococcal, there's a lot of meningitis, okay, but it's seasonal. So a meningococcal vaccine is not paid for by Bill Gates, but it costs 400K. Dr. Dan, why are you charging me? Hey. Now, an issue that I have with you guys, you mothers, including Lisa, and I had someone threatened to sue me last week. And the reason is, these people, your people, where do you get information from?
Social media.
Someone told you, someone comes and tells you, when you go to Dr. Dan's place, ask for the Painless vaccine. Have you ever done that one?
Yeah, painless at around 6 weeks, painless vaccine.
Why?
Because until the child is going to cry too much the whole night, days.
Do you see? You see? So, if you've ever seen a ped give their child a painless vaccine, you tell me. So,
So, what's the theory?
it's a marketing gimmick.
Really?
Yes.
Yeah, but
It
actually,
is.
Mine still
Yeah,
cried
the
even
mother,
with
the
painless.
mother, the mother wrote to me and said, "I'm suing you." My child still cried. But I came insisting for a painless vaccine. They gave me one, and the child still cried. And I'm like, first of all, who told you to get? So first of all, when your child is from 6 weeks, 10 weeks, and 14 weeks, all right. So from 6 weeks every month, you should vaccinate. Okay, 6 weeks. What is a month after 6 weeks? What is 4 weeks after 6 weeks?
10.
And then 4 weeks after that?
14.
Exactly. So 6 weeks every month, you're given the same batch of vaccines. And one of those vaccines is DPT, diphtheria, pertussis, and tetanus. All right? So pertussis is the vaccine for pertussis is what causes you people issues. All right? And the reason is when you inject it, how does the body know it has gone in? The body reacts. How does the body react again? Fever. You remember?
Yeah.
Fever. So fever is a good
Sign.
right? So fever. So these vaccines are eliciting a fever, and I keep telling mothers, don't give your child fever medicine because you're blunting the immune response. So you'd rather your child cries for 2 days and they are protected for 20 years and you give them paracetamol for pain and fever, and then your child is protected for only 5 years. So the idea is, in fact, the more the fever, I am happy. All right? So here you are. So pertussis really elicits serious fever, elicits generalized pain. So guess what mothers don't like? Their child crying. So guess what some random guy in France says?
Painless.
I can make you a painless one. What does he do? He removes the immunogenic part so that the immune system doesn't overdo it, so that your child doesn't overcry, so that your mother is happy, and the charges is 5 times. Now, the DPT is already paid for by Bill Gates. It is free.
Yeah.
It is more effective. Yes, your child will cry for 2 days,
They won't
but it is
die.
more effective.
Yeah.
It is free. Now you come to me. Those days I used to tell my people, don't give mothers painless, until these people said, "Banange, they are going next door." I'm like, it doesn't matter. Now they are giving. Let's give what the mothers want. Okay. And I tell them, you first tell them that they are getting the worst vaccine. No, they told me it is painless. So you're giving your child painless, you're paying 300K, it is less effective. Your child half of the time is still going to cry anyway.
Yeah.
Then you're going to sue Dr. Dan for giving you a vaccine that your child will still cry anyway, which I hate. So those are the
You're
things.
going through it.
Yeah. So for me, I don't encourage at all.
Yeah.
I don't encourage at all children. Even my own children, I didn't give them anything called painless. They had to cry. And my wife, of course, was like, next time we do painless. I'm like, because seeing the child cry,
makes us miserable.
Yeah.
But then
And that's just for a few days.
Yeah.
And then they will be fine. And you don't give paracetamol.
Before and after.
What does paracetamol do? Again, it will blunt your response. You understand? So what you're doing really is blunting the response. It's okay to be brutal.
It's okay to be brutal. Okay, Dr. Dan, we're concluding.
Okay.
Tips
Of what now?
of getting a good pediatrician. Because moms are out there looking, we are running from here to here looking for the best ped for our children.
I've never understood that point. Why? Let me tell you something.
Yeah.
The best doctor, if just that when I got kids, he had left the country. The best doctor, or the best in quotes. Okay, first of all, what do you mean a good pediatrician? That's number one. 2, what is good for me as a doctor has nothing to do with what is good for you. Because for you, your good is expectations.
Experience, they
Expectations.
can catch the thing.
You see, expectations.
Okay.
Which might have 0 to do with your child's condition. You understand? 0 to do with your child's condition. So me, I keep saying that, you know, there's a very brilliant guy I was in medical school with. If my child was sick, I would have taken him, but he's not a ped. Okay, but I know that he reads a lot. He's very insightful. He's very that. These are not. He may not communicate well, so the mother understands, but I will know that I'm in good hands. Then there are doctors who communicate well, and it's important. But what I keep telling people is that your definition of good is really relative. Okay, I keep telling my workers that, you see, even a nurse can treat malaria. All right, it is how you make the mother feel at the end of the day. The mother has come with a sick child. Can we make the sick child better? Everything else is background music, right? Even a nurse will treat your malaria. Even a clinical officer who's a diploma holder will treat your malaria, will treat your flu. Okay, but who's going to be able to tell you that, you know what, it will be okay? I think mothers prefer doctors who show empathy. Take my number, call me at 3 a.m. if your child gets worse. Okay, that has nothing to do with the genetics of which bacteria. Okay, there are doctors who know the genetics and the minuscules, but they can't communicate that, and they don't want you to contact them, and they all that. So that's number one. So for me, I always say that many times, if you say a ped, right now I think the universities that bring out peds are still few. I think it's now only, they're still like 4 now. Right now we have like 14 to 16 medical schools, but I think only 4 bring out peds, and they're all good. So for me, any ped is good, right? The issue is communication. I have 2 peds. We have, I think like 3 years ago, they came from Bara. You might find that one time, they're all classmates, yet when they come to Nadia, everyone wants ped A. Ped B did much, was top of our class, did everything, but no one wants to see ped B. Everyone wants to see ped C. So your definition of good
but then
is
how
different.
Come a mom will
Number
say,
one.
yes.
No, it's communication, empathy, and treating the person like a person.
Yes.
All right? Because when we're in medical school, one of the key things previously, it was a paternalistic relationship. The doctor knows it all. This one doesn't know. You understand? You're not putting yourself in your what? In your child, in the person's shoes. What are your concerns? Like when I just graduated, I kept saying, no formula. Breast milk, whatever happens. But then as you enter this system, you understand this is a PhD student, a lady she has flown in from wherever, or she's a lecturer. There is no way, there are dynamics. You're not looking at her as a disease, but you're looking at her as a human being. So how can I help you to make your child well in your context, not in a textbook context? So that's why I said, you might find that this doctor, I admire the one who's textbook. But for you know, because I kept asking when I just started my private practice, why do you go to so and so? Why do you go to so and so? And parents used to tell me, this one's like a grandmother. It's like a grandfather. He remembers the sibling's name. He remembers which school. This one. How can I not come back? No, it has nothing to do with the condition. So I think medicine, we're trying. The younger peds are trying. But the older peds had been taught, you know what? No relationship with the
patient.
Because you'll be going through a lot of things. When a patient dies, you need to make sure that you're not over concerned, otherwise you get depressed. But now you're really interacting. Many patients feel that if a patient doesn't, many mothers feel that if a child doesn't get well immediately, the ped is bad. And that's one thing I've seen, because you see that, I keep telling people, when your child has a viral infection, the minimum time you need to give is 5 days. Now, your child can get well in 3 days, your child can get well in 2 weeks. There's no way of knowing. It depends on the child, what you call the physiology of the child, and also the disease. All right, you find that actually the dose of bacteria they got was little, so it can easily, or by the time I examined you, the symptoms hadn't come out. All right, so half the time you'll find that a child goes to a certain clinic, the other side then they go to this one and they come to me. By the time they come to me, the disease, the conditions are so obvious, you make the diagnosis. Sometimes they first come to me, it's not obvious. By the time they go that side, you say, hey, why did Dr. Dan pick it up?
Yeah.
Right? So children, especially children, change very fast. Remember you asked me, why do you want to be picked? Because children change fast. The child is playing today, they collapse and they're sick. You get my point. But for adults, it's really insidious. You can easily tell, and then once, you know. So for children, many mothers feel that if my child hasn't gotten well, let me change. But what we encourage is follow up and coming back to see the person who saw you. So not only on your part, but even us, we're trying to change our the way we see our children, right? So that I think last year we told all our peds that, you know what, don't discharge a patient until 5 days after you've been seen. In fact, the biggest complaint I want from my patients is, Dr. Dan, you call me too much. All right? Because the process because studies have shown, actually, if you go to Mbara and Malago, these studies have shown that children who've been discharged from those two, and those are the two top universities, they have the top pediatricians in terms of departments and follow-up and everything. So those two, they are teaching hospitals. So you find that the vast majority of children discharged from those hospitals within 90 days either had died or had fallen sick again. And that was because the care was only in hospital. So we're trying to introduce something called post-hospital care, right in the community. Not just the community, but if a child is sick, can we not consider them discharged until after day 5? Because many mothers feel that if I came on a Monday and by Wednesday my child is sick, I'm going to jump to another place. And then what you find is that they have to start again. All right? And yet, actually, if you just continue the treatment, your child will have gotten well. Yeah. So working with the patient is also very important.
Wow. Wow. So where can people find you? Oh, if they want more information, they want support, the kids, just tell us again, you had mentioned.
Unfortunately, I'm difficult to be found. That's number one. And that is why I multiply myself. So that's why I've said at the beginning, we're at the Children's Clinic Nalia, Children's Clinic Nigeria, Children's Clinic Xasi, and Children's Clinic Gayaza, which has just opened. I am the worst ped of them. Yeah, so for me, I see patients, but very rarely, because I'm more into growing up. Yeah, teaching, regulating, and growing the facilities, so that even somebody in Gulu can have a children's clinic. Yeah, and so that's really what I do now mostly.
Oh, thank you so much, Dr. Daniel. For being here. We've learned a lot. I am going to change a few things in my home, and I hope you guys have learned a lot too. Let us know in the comment section what has been your experience, how are your children, what are those, tips you've picked from this interview that you think a mother out there would benefit from. Don't forget to like, subscribe, so that this video reaches so many moms and they could save so many children. My name is Lisa Kusima. As always, I'm here to inspire.